experienced severe anxiety and panic attacks? Hello, I'm Dr. Steve Hotze. Be sure to subscribe to our YouTube channel and follow us on Facebook. I believe that you need a doctor and a medical staff of professionals who can coach you onto a path of health and wellness naturally so you enjoy a better quality of life without pharmaceutical drugs. I ask you, have you ever had anxiety and panic attacks? Ended up going to the emergency room or going to your physician's office and you're prescribed anti-anxiety medications, antidepressants, sleep medication. You may even be given a shot for your anxiety. Well, you realize those are just symptomatic pharmaceutical therapies that mask your symptoms. They don't get at the underlying cause of your anxiety or of your panic attacks. Anxiety and panic attacks commonly occur in females as they march through their menstrual life when their hormones become imbalanced. It can happen right after puberty. It can happen in your 20s, 30s, or 40s, or after you've gone through the change. Women make two primary female hormones, estrogen and progesterone. These are the two classes. The estrogen hormones start being manufactured by the ovaries on day one, the first day of the menstrual cycle. In mid-cycle, when a woman ovulates, she makes progesterone. Estrogen is a proliferative hormone. It proliferates the inner lining of the womb. It proliferates the breast tissue. Then is balanced by progesterone, which matures the inner lining of the womb, preparing for a pregnancy. So there's a seesaw effect here. You've got to have balance between your hormones. What happens in women when they have panic attacks and anxiety attacks, which often occur premenstrually, these attacks are caused because they're not making enough progesterone to balance the estrogen. Their estrogen dominates. They've got too much estrogen compared to progesterone. And as women march through their menstrual life, the ovaries make less and less progesterone, particularly when they quit ovulating or when they have anovulatory cycles, which happens during the 40s. When women are in their 40s, oftentimes they will miss ovulating, and that will have an adverse effect on their hormonal balance. It's oftentimes symptomatically seen as a sign by the increased menstrual flow. The periods, instead of being 3 to 5 days, are now 5 to 7, 7 to 9, heavy clotting, a lot of cramping, and you may have some breakthrough bleeding. This is a sign of estrogen dominance. So premenstrually, women can have mood swings, fluid retention, weight gain, migraine headaches, breast tenderness, severe cramping. They can end up having irregular cycles. All these are signs of progesterone, and they can be easily corrected. That's right, your panic attacks and your anxiety attacks can be easily corrected by taking natural bioidentical progesterone on day 15 through 28 of your cycle. And that will regulate your cycle, that will regulate your moods, help you sleep, and you will feel like $1 million. Now, this is particularly important for women that have gone through a hysterectomy and all they're put on is estrogen. They've got to have that balanced, and most physicians don't realize that. They think the progesterone is just for the uterus. It's not, it's for every cell in your body. Most importantly, the hormones, both in males and females, affect our brain chemistry and how we think and feel about things. So you want to make sure, if you go through a hysterectomy, your physician puts you on natural, bioidentical progesterone. That's just a short little brief. Remember, every one of you needs a health coach, a doctor who'll coach you onto a path of health and wellness naturally so you enjoy a better quality of life without being given pharmaceutical drugs. I'm Dr. Steve Hotze. Thank you so much for joining me today. Now be sure to subscribe to my YouTube channel and follow me on Facebook.